Another question about weed. You guys really seem to like these weed questions. So this one is kind of roughly what can cause the increase in psychotic symptoms in people who are using marijuana? So the first question I like to ask when I get questions like this is that a thing? Like, does smoking weed increase the risk of psychosis? And the answer is yes. So if you are a daily user of marijuana products, your risk of getting psychosis is about 3 times higher than that of the general population. General population is somewhere around 60 per 100,000, so that puts you around 180 per 100,000. If you are using higher doses, that risk goes up, and if you are using high potency marijuana daily, your risk goes up kind of dramatically. So that's saying like more than 10% THC in whatever it is that you're using, that risk will increase up to about 5 times the kind of general average. And that is partially because, like, if you've been in the marijuana, realm for a while, then you may have heard that if you are too high, sometimes you can take CBD to help bring that back down. And so, if you're using really high potency marijuana, high THC potency, then it has less CBD, and a lot of those things that we're talking about are very much related to the THC part specifically. So then we have to talk about what is psychosis. Psychosis can be a lot of things, and interestingly, if you take high doses of like THC and like IV THC specifically, you can temporarily cause people to have psychosis, which is things like paranoia and disorganized thoughts and the inability to carry on conversations and lack of motivation, those sorts of things, which a lot of people are kind of searching for when they're using these sorts of things. And so you're reinforcing to your body this desire to have those symptoms, right? And so it shouldn't be hugely surprising that if you continue to do that day in and day out, that your body will respond by continuing those symptoms. So another thing that we know is that the earlier you start using marijuana, the higher the risk of having these kind of psychotic symptoms. So especially before that sort of third neurological pruning or before about the age of 25, if you start using then, up until then, your brain is still like creating the connections for your prefrontal cortex. Your brain is not fully developed until then. So then you're taking this extra thing and you're putting it in there, which kind of, if you think about building a house or something and you have like scaffolding, and every time you go to do something on the house, they just kind of move the scaffolding over. You're probably going to have some weaknesses in how you're building that house. And that's kind of what we get with the THC thing. So, does weed make you psychotic? Probably not. There's a big genetic component that has a lot to do with this. Kind of various genetic markers like AKT1 and COMT can variability on those can increase the likelihood, but those are kind of like you already have this predisposition to have psychosis. And then weed just makes it more likely. So you already have a little bit of fire, and then you throw the gasoline of weed onto it, and now you have this psychotic episode. So what causes it? Big question. So CB1 receptors are the primary target of THC in your brain. If you load up those receptors a whole bunch, then you get this kind of dysregulation downstream of dopamine. And dopamine causes a lot of those psychotic symptoms that we see in people with schizophrenia. So when you look at antipsychotic medications, they're almost always going to be playing with dopamine in your brain to kind of regulate that out so that you lose those psychotic symptoms. And what this does is it just replicates the part of it that would cause the psychosis and increases the dopamine in those areas. So generally, when I'm doing my videos about medications, I'm talking an awful lot about how we want to turn down the volume on all of these different things. We have too much anxiety, we turn down the volume. And marijuana, THC specifically, turns the volume up on those specific kind of psychotic pathways, right? So do I have a really kind of easy bite-sized way of telling you why it is that THC can cause psychosis? I don't. It's kind of through a lot of variable pathways and a lot of different things, but does that happen? Is that a real thing? Yes. Does it increase your risk if you already have predispositions? Yes. If you already have psychotic disorders of some kind, should you ever use weed? No, you should not. Just kind of like how people with diabetes may really like chocolate cake, but that doesn't mean that they get to have it, unfortunately. And it's kind of the same thing with marijuana and psychotic disorders. I guess the next one that I'm going to do is going to be on the cannabinoid hyperemesis syndrome. So stick around for that.